I was having a conversation with a patient and they described getting a transplant as interviewing for your life.
In this country, waiting for a transplant is complicated. It's a long road with lots of hurdles to jump through, especially when you're not feeling well. The toll that kidney failure takes on folks, both physically and mentally, it really is a lot for people to deal with.
One of the biggest contributions that TREAT has had to patients is to identify really critical gaps and barriers in the process of getting to kidney transplantation.
We developed some online dashboard to help the general public to understand what our research findings are. And we also developed some mobile app called I Choose Kidney. It's a risk calculator designed to educate the patients what the potential risk and benefits of your available treatment options. Delivering those information in the hands of the patients and their families will give them more confidence about their possible options.
This has been the academic life work of Dr. Rachel Patzer, our lead. Before she started what has now developed into TREAT, we as scientists didn't really know what was happening and how patients were progressing through the transplant care process until they reached the wait list. And for a lot of patients, that's already way too late.
We're the only place in the entire country right now that has data on referral and evaluation and some of these early steps to the transplant process. One of the things that's most rewarding is being able to see a clinical provider say, wow, I did not realize we were among the lowest in this metric. And then going back to their outreach teams and talking to them about what can we do in our processes to change that. I think that has a lot of impact on patients.
TREAT started as a collaboration between researchers, clinicians, and policymakers in the southeastern United States, where at the time we had the worst rates of access to kidney transplant in the country. That's actually no longer the case anymore, in part because of some of the research and policy and interventions that the team has done. So we've now expanded our focus to be more national and to think about non-kidney organs such as liver, heart, and lung.